Welcome, welcome, welcome to another The Nurse Kristen YouTube channel episode. And for any of you guys that are listening on the audio on the podcast, welcome, welcome. I am so excited for this next week's topic because this week I feel it's going to be for my nursing students, but I also feel like it's definitely for my new grad nurses out there that I just graduated and are brand new nursing students. I just feel like it's going to be helpful for both. So, Kristen, what is the topic this week? The topic this week is all about how to give the best effective nursing report at shift change. So, you know, those reports, I know for any of my nursing students out there, you are going to have experienced it when you're at your clinicals. You're going to see the nurses when there's that shift change in the morning or in the evening when night shift comes on. They give each other a report, right? So it's learning about that patient, what's going on with that patient, what's happening, any sort of anything that is going on to allow the other nurse that's coming in that's going to be taking over what's been happening during that day, right? All the meat and potatoes, as I want to tell everyone, like just the real true information of what is happening. So it's all about giving a really, really good report. So for my nurses out there, my new grads, this is going to be very, very important as, you know, sometimes it takes a bit, right, to kind of get really comfortable with a good flow. I can tell you for sure, whenever I first was giving a report as a new grad, it was a little terrifying at first. I felt like I was really all over the place, but I am going to help you guys through this, okay? So for my nursing students, I want you guys to pay attention as well, because when you do go to your clinicals, you are going to have days where the nurse is going to have you give the report to the nurse that's coming on, and then they'll be there to just help you out and kind of fill in anything. But for my new grads, this is definitely for you, because this is going to be imperative of making sure that everything is being talked about and everything's being presented in a really effective manner, right? So giving a report is so, so important. So at the shift change, it happens at shift change, right? So I'm going to have 7 tips to give you guys that is going to be helpful and able to give the best effective report at shift change. Okay. So we're going to just dive right in. Okay. So tip number 1 that I have written down is starting early. And what I mean by starting early is make sure you have all your ducks in a row whenever it's shift change and you're ready and the nurse is there waiting to get a report for you. So as the day is going on or the night's going on, make sure you're getting all of your stuff organized. Make sure you have all of the papers that you're needed. Make sure you've gone through their chart and seen their care plan, and make sure you've read through everything that you're needing to and have everything together so that when the nurse comes on, you're ready to go and you've got all your information ready to go for them. And they're not waiting on you for you to like find everything, right? Because that can be like the worst case. And yes, there are going to be times that the shift was absolutely insane and they probably didn't have a moment to really sit down and do a lot. Yes, that does happen. However, if you can help it, please, please, please try to organize yourself ahead of time so that when they come, you're ready to go. You've got all the information ready to go and you're set, right? So that is the first number 1 thing I want you to do is start things early. So make sure you prepare things ahead of time, review charts, medical records, care plans. Do all that ahead of time when you write everything out for the nurse that's coming after you. It makes it super, super helpful, right? So that's tip number 1. Make sure you do things early. Start early, okay? Tip number 2 is going to be communicating things very clearly. So what I mean by communicating things very clearly is make sure that when you are there talking with the nurse that you're using language that they're going to understand. If you notice that you're abbreviating something and they're giving you a look of, I have no idea what you're talking about, explain to them what it is that you're talking about, or, you know, whatever the procedure is. Maybe they've never seen it before, heard it before, anything like that. Make sure that you are clearly communicating everything to them in a way that they understand. And obviously, if they don't understand, I hope that they're asking questions. But you just want to make sure that you're communicating everything in a very clear manner so that they understand the exact patient's condition, what they have going on, so that there is no discrepancies. There's no black, gray area, white area, or anything. They know exactly what's happening. So make sure that you really are communicating in a very clear, concise manner so that they understand exactly what you're talking about. So that is tip number 2. Make sure you're very clear. Make sure you're very concise on everything that you're explaining to the nurse, okay? Number 3, make sure you're prioritizing your information. As far as just like the most critical information for a patient, right? So, I mean, one of the most things is what the patient's there for, what kind of labs they have going on, if there's any critical labs that the nurse needs to know about, if there's any tests or scans that this patient is going to be having going on that day that need to be addressed. Just anything that is a priority that the nurse needs to be aware of. Make sure you prioritize all of that. Make sure you tell them, like, this needs to be given to this patient, or even if it was something that you did not do yet. Maybe it was a crazy day and you didn't have time to hang their antibiotic that was just due at shift change, or maybe there was something that you forgot to give them that you meant to bring into the room and you totally forgot because there was a lot going on. Make sure you make that known to the nurse so that they're aware, so that they can get things completed if you didn't get it done. But also just making sure that you are prioritizing giving them the right information that is needed. I can't tell you how many times this has happened to me where I have walked in and I've noticed just certain things that were not done, and it wasn't actually told to me that they were not done. And it just kind of made the beginning of my shift a little cray-cray, because I was trying to finish up some things from a previous shift and then yet start back on the stuff that I needed to do for the current shift, and trying to understand like what all was going on. And I could tell it was a very, very busy day. It was a very busy, day shift, right? It's just, there was a lot going on and I could tell. But just make sure, please, 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 you are prioritizing the right kind of information to the nurse and letting them know about anything that might need their attention right away. So like I mentioned, lab results, if there was a very high number, low number that needs to be done, if there's blood that needs to be given at a certain time, just anything that is of a priority, make sure that you let that nurse know. So if something during the day or whatever, just make sure you're prioritizing all of that with the nurse. So that is my tip number 3. Make sure you're prioritizing information that you are giving to the nurse, okay? Tip number 4, use a standard format every time whenever you give a report. And what I mean by a standard format is I can't tell you how many times I have been given a report and it's like, this is this patient, here's their history, their AO in ×4, they have a 21 gauge in their right AC, they have a normal saline running at 125. Oh, did I tell you about that sore on their butt? And it was like jumbling all over the place, guys. I can't even tell you how much it was jumbled. But what I mean by standard is make sure that you're like going in order. Like make sure you have what I call like an S-bar sheet. So, and I'm going to show you some examples. So you can have something like an S-bar shift report sheet, which is just like this one. And I'm going to make sure this is downloadable so you guys can have this as well. But this is super helpful. So if this is something you want to fill out, and then it's super easy, you can just go down this sheet and talk to your nurse about it. And this gives you the whole situation, the background of the patient, the assessment that you were given of this patient, recommendations, if there was any tests that need to be done, any labs that need to be done, any medications that need to be given at any certain time. It's just very organized, right? So there are going to be people, have like an S-bar sheet, or you're going to have people that have like legit report sheets. And so personally, I used a report sheet. That was this one right here. So I'm showing it on the screen. And again, I will have this in the lower comments that you guys can download online. But this was my report sheet, and this was very standardized for me. So pretty much it was, I went down the line and I just had the doctor's information, patient's diet information, if they were a full code, what they were there for, the neuro, and then it just literally went from like body system down, right? So it just went blah, 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 all the way down. And you want it to be like that. You don't want to be someone that's going to be jumping from like one body system to then, oh, they have a history of asthma, or, oh, they had, a 22 cc of that, or a 22 gauge that they ripped out. Now they have a 21. Oh crap. Well, which arm was it? And like, it's just like, I've had nurses that have gone literally back and forth about everything. So I want to make sure that when you give a report, make sure it's very fluid. Make sure it's very from the very top of just, here's the patient, here's when they were admitted, here is their history, here is, the body system, go from like the top down, and any labs that need to be done. And then obviously anything that needs to be done on the next shift, make sure you let them aware of that. But please be organized with this and make sure that you write it all out, organize yourself, so that you're not one of those nurses that's like all over the place, because nothing's worse when you just already feel disorganized when you listen to a report, because that nurse is like bouncing from every different direction of information and you're trying to follow, but it's just not like connecting. So it's really good to just have a standardized sheet like this S-bar sheet or that report sheet that I showed you guys. It's super helpful because you can literally just read it from down on for all the information that you need for a patient. So find yourself something that you like. I know for some people, it's trying different ones, trying different things to see what you like, what you don't like. Try different other people's report sheets, see if that works for you until you find something that like clicks, that you really like, it fits your flow, all that stuff. So just make sure you find something that works for you, that makes it easy to follow when you give a report, okay? So that's my tip number 4. It's just making sure you have something standard. So like any of those sheets, okay? Tip number 5 is make sure confirm the other nurse's understanding. So when you're giving a report to the other nurse, make sure they're understanding everything that you're talking about as far as the medications or the test orders or the care plan or just anything that's going on with the patient. Or if you know that maybe they're a newer nurse and they have blood needs to be given, confirm with them that they've done blood before, or if they understand what you're meaning as far as what kind of medications they're needing, or like when they need something by, if they have a question about a particular medication that you're giving or why, or just make sure any and all information that you are giving to that nurse, that they're understanding exactly what you're meaning, and make sure that, they're not just nodding their head, but like actually telling you, yes, I understand that. Okay, great. And then tip number 6 that I have for you guys is making sure you're providing context for the nurse that is coming on for that patient. And what I mean by that is making sure you're giving them relevant information that they absolutely need to know for this patient for the stay at the hospital. I have had it to where I have had nurses in the past that literally want to give me information about a patient from like 20 years ago about a procedure they had and whatever antibiotics that they were on. I mean, unless they were allergic to that antibiotic, but it was just like unrelevant kind of information that pertained to the patient at this moment in time for this admission or this surgery or whatever, right? So make sure that when you are getting all of your information down for patients, that it is relevant to their stay at that point, and it's not something that is from a long time ago, because otherwise you're going to lose your nurse and you're going to be there forever trying to explain things, and it's just not going to be a very good situation. So just make sure whatever relevant information you have that has to do with that patient at that moment in time, that is what you give them. Don't give them a bunch of fluff information from the past. They're not going to care. So it's like the meat and potatoes of the information that you give to the nurses, right? At the nurse shift or at the change of shift. So make sure that's what you're giving them. It's just exactly anything and everything that is going to be meaningful for that patient, for that shift, for that admin that they're there for. Don't give them a bunch of extra information that they're not going to care about. So that is tip number 6. And tip number 7 is going to be all about following up with the nurse. So once you've given them a report, you're going to probably be giving some other nurses reports too. Usually it's very lucky if you get the same nurse to have all your patients. Doesn't necessarily happen that way, but sometimes it happens. But not if you give a report to someone else, make sure you follow up with the nurse. Ask them if they have any questions. Ask them if they have any outstanding questions, concerns about a patient's status or anything that you had disclosed to them already, just to make sure that everything is out there in the air, because once you leave, you leave. And I don't know about you guys, but I definitely have had it happen where I'll go home and I'll be like, crap, I forgot to tell the nurse about this, or I forgot to tell them about, they needed this or they needed that or something, right? I think a lot of us nurses have done that, right? Where you go home and you're just like, oh my gosh, you totally forgot about telling a nurse something, or you think you told them, or you think you didn't tell them, but then you end up calling them and like making sure. So just make sure you follow up with the nurse, make sure they don't have any other questions, and just kind of go from there. So we're going to kind of recap a little bit. So the very first thing we talked about was making sure that you're starting early. So make sure you prepare your stuff as early as possible to make sure it's all organized, ready to go for whenever you need to give that report to the nurse. Next, make sure you're communicating clearly to the nurse. So make sure everything you're telling them is very clear. Make sure if you're using any sort of abbreviations for anything, they're understanding what you're talking about. Make sure everything's clear. Make sure they understand. Third thing, make sure you're prioritizing all the information. So if there's any outstanding labs that you haven't looked at, or if there are labs that have, high number, low number, if they're needing replacements, anything that is of a concern that is a priority, if they have a stat MRI that they need to go to, anything that is of concern, right? Like a priority for a patient that needs to be given, or maybe there was an antibiotic that was missed that you didn't quite get done before the shift and they need this antibiotic hung like ASAP, right? You want to make sure that the nurse is aware of like absolute priority things that need to be done for a patient. So make sure you guys are doing that. And the next thing, making sure you're using a standard format like I showed you guys with the S-bar sheet and that report sheet. Those are very, very helpful and able for you to kind of brain dump all of your information onto so that when it comes to giving the report to the nurse later, you have all that information and it's organized and concise and you can just go right down the line and give your report. So make sure you guys have something like that. You can always try anyone and everyone's different kinds because I know we're all different as far as what works for us. Try different ones, see which one works best for you. Next would be making sure you're confirm the understanding with the nurse. Make sure they're understanding everything that you're telling them. If they're asking questions, make sure you're providing the context, like I mentioned before, making sure it's just relevant to this patient as of now, at this admit, for this diagnosis, for this whatever that brought them to the hospital to begin with. Don't give a whole story about this patient from 20 years ago, please. We don't want to hear a whole story. We just need to know the meat and potatoes of this patient and able for us to take care of them for this shift. So make sure you guys are doing that. And then just follow up with the nurse if they have any questions, any concerns, anything that they can help or anything that you can help address with this patient before you leave for your shift. So if you guys have any questions on that, I would love to hear any questions you guys have. If you guys have experiences with giving reports or if you have any feedback on it, please let me know. You guys can always DM me. You guys can always comment. You guys can always write me. You guys know where to reach me. But yeah, I hope you guys all do excellent in giving your reports. And next week, we're going to have another amazing content to bring for next week. I have another subject matter that I know everyone's going to love. So thanks again for tuning in to the YouTube channel, or if you guys are listening on the audio, thank you, thank you, thank you. And we will see you guys again next week. Thank you so much. Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here. And if you have any questions, concerns, any other topics, anything you guys would like to talk to me about, make sure you guys leave me a comment below. Thank you so much. You guys have a wonderful day.